En 2023 dimos un nuevo paso hacia el futuro.
In 2023, we started a new stage through technology, science, into health. A new destination, 2024. Our trip continues. Come along with us in order to be inspired, to reach wherever we would like to arrive, and as near as we would have never imagined. Today we are going to describe all together. Welcome to Future Health. The future is now. Goodness gracious, how well we are starting today. Hello, good morning. Hello, good morning, Mark. Hello, Lucia. Welcome you all to the Future Health, the event. We are here all together to try to think about the health of the future and of the present. The future and the present both think together the different digital tools that might improve life not only to the patient but as well to the doctor. We are always speaking about how to use the different tools, the digital tools, but I think that one of the most important technologies and initiative is how Sanitas has, with more than 70 years experience of taking care of people, is to take care of this network and how to use all these digital tools in order to improve our lives and how to embrace the future. How Sanitas will help us to recover the health that we've lost and to improve our lives, to focus on prevention, which is so important. And Sanitas continues to look after our health throughout all the different innovations and the different tools that we have available. So I give you the floor and we are going to start with our event. Today, Sanitas wants to share with us this new vision of health in the future. As Mark said, the vision of the health of the present. This is now and here, and to create and to enter this new paradigm is to try to answer many different questions. The first one, how do we conceive the buildings and the hospitals of the future? What are the limits and how to use in the better manner the devices and the instruments that we have? So today it is a very important day in order to reflect upon how to do this, and we are going to do it together hand in hand with many international experts. We are going to start with a very special person, Prime Minister of her own country in 2027 till 2023, that had to face one of the most important challenges, health challenges, that was the COVID-19 pandemic. Not only she had to face that difficult moment, but as well she has taught us a new way of implementing politics and a new way to understand technologies through the web. And today we have together with us one of the most influential people from the world, that somebody that says that new technologies are a source of hope for new technologies that hope to reach. And Future Health, the event, we would like to introduce Jacinda Ardern, the Prime Minister of New Zealand. Thank you very much, Jacinda, for being here with us.
And thank you very much for being with us here today. It's a real privilege to have this conversation. Thank you.
Gracias. And My apologies that the rest of the conversation will be in English. Mi español es malo.
It doesn't sound bad. Well, Ms. Harder, today we are addressing different issues related to health and technologies. You have stated that democratic governments must guarantee human rights and the long-term welfare of people through a constructive use of technology. What do you consider to be a constructive use of technology?
I mean, I think the first thing that I should say is that my background is not as a technologist, is not as an innovator, is not as a healthcare professional, but essentially as a regulator and a leader in a very dynamic environment where we've seen rapid technological advancement that we know has the potential to be hugely beneficial for users, for citizens, when deployed in a thoughtful way. And you will know better than me that in healthcare, we're seeing that enormous potential in real time, whether or not it's research and development. You know, you look at the way that AI is being applied for product development now, whether or not it's the user experience, the way that we can increase productivity, you know, improve the experience of the user, make healthcare more accessible. And that is one thing COVID brought us, was just an increase in our understanding and appreciation of how virtual consultations can be used, even to diagnosis. I mean, the fact now we can see AI being used successfully, almost as successfully, to identify skin cancer as it might be solely if we were using a specialist. So we can see the benefits. I think what we have to be cautious about is not to simply assume that because those benefits exist that there are no costs or downsides. And so as we look to deploy this resource, this tool, thinking constantly about where we may see the downsides to someone's individual privacy, to the use of their data, taking an ethical approach and a thoughtful deployment, no matter what area of its use that we're looking at, be it healthcare or otherwise.
We all know that the impact of technology is increasing. We are witnessing innovations that can involve significant advances and opportunities, but also can imply some challenges. How can we ensure that this digital transformation progresses for the common good?
Yeah, and here I reflect just back on some personal experience. While I was Prime Minister of New Zealand, we had a horrific event on the 15th of March 2019 where essentially a terrorist who was from Australia came to New Zealand and undertook a domestic terror attack. He opened fire on 2 mosques with the intention of taking the lives of as many members of our Muslim community as possible. Now, how is this relevant to the conversation here today? Well, as part of one of his weapons was to use the online environment. He live broadcast through Facebook this attack. And it was streamed for 17 minutes before it was removed. And in the aftermath, it was uploaded to YouTube once every second for roughly 24 hours. So it became prolific. Now, this was one of the first times that we found ourselves at the forefront of a conversation around the way that technology was being deployed in a negative way. Here was a tool that previously, of course, was going to be the great democratizer. The ability to live stream and talk live to an audience without the filter of other forms of media channels was something that was hailed by politicians as being an extraordinary step in the direction towards greater participatory democracy. And here, we saw this tool being weaponized. And so I use that as an example that when we're looking to make these advancements, it's easy, of course, to do the sell around the pros. We have to think around constantly, have an eye to how could this be deployed or weaponized in a way that, of course, is not beneficial to society. Because building guardrails after deployment is extraordinarily difficult. And so this is where the plea that I've made with technologists generally, particularly those now working in the AI space, constantly think about the worst possible scenario, the worst possible manipulation of the tool you're designing, and work backwards from there. What protections need to be built around that? And I would say that for the deployment of different tools within healthcare as well.
Do you believe that technology can also be a catalyst for building a healthy and environmentally friendly future?
Absolutely. And here I would really just say I'm a tech pragmatist. And so for me, it's about how do we just make sure that as we embark on this new era, we have a mind to both the positives and the negatives. And the way then to embark upon that, that pathway that we're already on and keeping all of these issues in mind is, in my mind, a multi-stakeholder approach. After the 15th of March in New Zealand, we said we want to work alongside the tech companies and not just take a regulatory approach, but take a bit of a co-design approach. So that is what we did, and we're still doing that work. I'd implore the same for health technology. Put the user at the table. Some recent research by Pew Institute last year found that more people in the United States feel negatively than they do positively about the advent of AI and what it will mean for them. There is a skeptical consumer base out there. People are feeling nervous. Only 10% felt that they felt generally just positive. So that tells us there's some work to do. So in my mind, the deployment and development should have end users, consumers at the table, bringing with them their skepticism, their concern, their issues with data sovereignty and the protection of their own information, because that is particularly critical in healthcare, alongside technologists, those who work as in the ethical space, those who work as regulators, all at the table, designing, I think, solutions that are fit for purpose and fit for the future.
As Prime Minister of New Zealand, you show us that the future leadership is kindness and empathy. But you also said that it takes strength to be an empathetic leader. Is it the value of empathy by leaders in crisis now?
Yeah. That's to the extent that really it's being valued as a trait within leadership at all. I don't imagine there's been many times necessarily when you've looked to politics and thought, that's a career that I'd like my child to go down. Or when, your child comes home and they're looking for great heroes that they might wish to write about for a school project. I don't know how often we offer up politicians as an example. Now, the reason I raise, children as a benchmark is it occurred to me somewhere along the way that all of those values that we teach our children, we try and teach our kids to be generous, to share. An absolute impossibility with a child, but you try. Be generous, share. We teach them to be kind and thoughtful. We teach them to try and think about the perspective of the other children that they're with. And at what point do we stop then having an expectation of that amongst leaders? Now, I think that there's a few reasons perhaps why. From the leader's perspective or from a leadership perspective, there are plenty of times where I've thought, well, my job is to build a sense of confidence in me. Because if there is a moment of crisis, I want people to look to me and feel secure that I know what to do and that I can manage the situation that we all find ourselves in. And I think it's easy to assume that in order to build confidence, you have to display a sense of absolute knowledge at all times. And so you very rarely will have a politician who will answer a question with, for instance, I don't know. And yet it's natural that there will be times in our lives where we will not know the answer. So I think it's very hard for leaders sometimes to reconcile that. How do I build trust and how do I build confidence without being brash, arrogant, overly assured, all of those traits that we do not teach our children? I was determined when I was in office that I was going to try and demonstrate that you could be kind, you could be empathetic, and you could still build confidence in who you were as a leader. And importantly, you could still be curious. You don't have to know all things at all times.
After that political experience leading New Zealand, you have recently been appointed to dual fellowships at Harvard Kennedy School. So now you are closer to the potential future leaders. Do you think that a new type of leadership can emerge with the new generations that are arriving?
Yeah, I do. And I sense a couple of things at the moment from that next generation, I sense an expectation. And I hope that expectation doesn't dwindle, because I think the moment that we have a generation who comes through who is void of expectation, it means they've lost entire faith in institutions and the belief that leadership makes a difference on anything. So I think we need to make sure that we really cultivate that. But I also sense from the next generation a desire to be willing at times to move away from deeply held partisanship. You know, I think increasingly we're in a world, and I don't just mean political partisanship, I think we're increasing in this world where we're very binary. It's much easier to be very black and white on issues, and I do think there are certain things that exacerbate it. I don't think social media is entirely to blame, but it certainly makes it easier to find your tribe, stay in it, and then from that point, everything in this corner is good and everything over here is evil. And the more that we have that binary thinking, the less able we are to come together to build consensus on issues and find solutions on issues. So my observation, and I don't make this particularly to the United States, I think it's a global trend. I think the next generation want to see us work together to find long-term solutions for intransigent, difficult issues, be it inequality, be it geopolitical conflict, or be it climate change. And I think that's something that all leaders need to actually take heed of at this time in the cycle.
At Harvard University, you are inspiring the leaders of the future. Can you tell us about some of the top tips you give these students for dealing with this challenging world?
I talk a lot about crisis leadership, and that may well be because we had a particularly rough run in New Zealand, but the world has had a particularly difficult run in recent years. I came in at the end of 2017. At the moment I came in, we had a major biosecurity incursion, an illness called Mycoplasma bovis. Now, for most people, if you get an illness amongst your cows, it may not be a big issue. When you have more cows than people, it's a very big issue. And so that was the first thing that was on my plate. It was about to wipe out $1 billion of productivity out of our national herd. We then had the domestic terror attack. We had a volcanic eruption that took the lives of 21 individuals, and then we had the pandemic and the ensuing economic crisis. We also had fires, floods, and other things along the way. And people often ask me about crisis leadership. What are the particular traits of that leadership, and what makes for a good crisis response? Increasingly, I'm of the view that the traits of crisis leadership are actually traits of good leadership generally, and that we should be in that footing at all times. And the ones that I observed that were of the most importance to me was first giving yourself permission to be authentic. And I think we tend to hold back as leaders because we have a view that if we show any human emotion, that will be a sign of weakness, and therefore we lose people's confidence in us. But people don't expect us to be superhuman. If you're in a moment of grief and they don't see you feeling that grief, it might be hard for them to relate to who you are as a person. And so I decided, I didn't decide, I knew no other way to be than human in those moments. But it's not enough to just be authentic and show emotion. In crisis, people will naturally feel like they want that channeled into action. Emotion without action will feel meaningless. And anyone in this room, I'm sure, has been in a moment which has felt particularly horrific and you've wanted to do something. As leaders, you're often the outlet for others when it comes to the do something. My example would be in March 15, when we had this horrific terror attack. It was committed using AR-15s, military-style semi-automatic weapons. Our view was those weren't weapons that our society needed. They were designed to take lives en masse very quickly. So we introduced a law and passed it within 10 days because people wanted to see their leaders act. And the final, I think, sign or characteristic of crisis leadership is proximity. I do not think that you can be a successful leader in a crisis without proximity to where the crisis is happening and who it's happening to. Otherwise, you won't know what is needed on the ground. You won't know how it's personally impacting those affected. And it is that fine line of making sure that you've got that proximity whilst you're not then delaying the ability to respond in the moment, but proximity, authenticity, action, that actually should be the traits of leadership we bring at all times.
I would like to delve into your leadership during the pandemic because New Zealand became a role model in many moments for all of us, recording one of the lowest infections and death rates in the world. How did you manage to get a whole country to follow the restrictions so successfully?
Joy, here I come back to one of those points I was making earlier. There's no better example of a time when people knew that their leaders didn't know everything than when that pandemic arrived. If everyone knew everything, then we all would have probably taken a similar approach, but we were learning in real time, and people knew that. That was the moment to stand up and say, we do not have all of the answers. Here is everything we know, though, and share that as transparently as possible, because then you're taking people on a journey with you, and when you come forth then and say, well, in spite of us not knowing everything, we have a plan, because that's a critical difference. It's not enough to say, I don't know, nor do I know what we're going to do. That's when people's confidence in you is probably going to ebb away. But the moment you then produce your plan, people understand how you've arrived there because they went on that journey with you. And that was absolutely the approach we took in New Zealand. For months, I would hold a press conference at 1 o'clock every day. I would share everything that we knew in that moment, where we were in our journey of COVID, and answer the endless questions from media in front of me. And that was live stream, it was live broadcast. People came on that journey with us, and I think that was one of the most critical parts of our response, because in the initial stages, it did create a unified approach.
Companies are constantly developing, using, and adopting data technology solutions to optimize business and to deliver better services to their customers. Do you think that we are living in a time where also social decision-making must be supported by data and technological experts?
Yeah, absolutely. I've been a believer for a long time in the strength and importance of evidence-based decision-making, evidence-based policy design. But what I would add is that you have to apply an overlay of human behaviour. It's not enough to say, well, the evidence and data tells us this, so this is now what we're going to do. Unless you have an understanding of human behaviour, all of the evidence in the world won't matter if whatever you've designed is not adopted because it isn't fit for purpose for people's lives. So taking a human-centric approach as an overlay is critical.
As you say, when we go through all these big challenges, empathy is the most remarkable value, quality that we must pay attention to. Many organizations are also investing in ways to make technology more empathetic, but how we can make technology more empathetic?
Yeah, and I mean, this is one of these, deep questions that I see now those around me in academic institutions grappling with. Trying to teach a machine or a system to be more empathetic when we haven't exactly always done a great job ourselves is a real journey. Because of my background, where I come from, is to start with really imploring those who hold leadership generally to take an empathetic approach. And then hopefully then what we'll see is that's filtering through in our technological advancements as well. We've always got to, though, question where the imperatives lie. And at the moment in the development of some of these tools and devices, where there's a profit imperative, you're not necessarily always taking an approach that is centered on the end user. And it just simply has to change. And so that's why I would again just argue for co-design, bringing the consumer in at the beginning. I'll give you one little example on that. It's not necessarily technology, but it is health-based. We have a mental health crisis in New Zealand. I would argue most countries do in some form. And we decided that before we were going to roll out any particular initiative to address that, we wanted to be sure of where the problems existed. Was it in our tertiary care? Was it in our primary care? Was it in accessing either end? And we thought, well, if we're going to undertake that piece of work, one of the people who should be at the table for this review should be a mental health consumer. Why not? You know, why would we design a policy without someone who had accessed those services in the past? And so that's what we did. Just thinking in that way at all times. And there were some who would argue that that wouldn't have been appropriate. I argued that it would be inappropriate not to. In my mind, for all design purposes, should have that end user involved.
Last year you announced your resignation because, as you said, you ran out of enough energy to carry out the position properly. Do you think that one of the most concerning issues in health now is the mental health and the emotional well-being of our citizens? Is this the biggest health challenge after the pandemic?
I think it is one of our, we have so many, but I think it is one of our major health challenges. And one of the interesting dynamics, of course, is if you talk internationally about, for instance, anything to do with cardiological healthcare, you might get some universal responses on how you deal with that. It doesn't have stigma attached to it. If someone says that they've got arrhythmia, you tell them to go to a doctor, see a specialist. The variation in the way that we approach the issue of mental health and well-being is vast. In some countries, I think you wouldn't even mention it. In others, it would be seen as something where it should be mind over matter. Don't seek help, you just need to push your way through. And so I think that global variation means that we may not, it's a little harder to get the momentum that we need around some of those issues, let alone an evidence base around the appropriate response. All I can say from a New Zealand perspective is we talk about it. And I don't underestimate how important it is that in New Zealand we talk about mental health and well-being. And I credit particular individuals. Rugby is quite a big deal in New Zealand. I'm not sure if you're aware of that. We're very keen on our sports. There was an All Black called John Kirwan, revolutionised mental health care by fronting a campaign on depression and speaking openly about the fact that whilst he was one of globally the greatest players of rugby of all time, he was in a dark, deep, depressed state. And him just talking about that publicly, what a difference it made, particularly for young men and boys. So when we came into office, we thought, we cannot take as a measure of success simply GDP. As is famously being said, it measures everything except that which makes life worthwhile. So we decided to create a well-being framework to measure the success of our nation. And when we analysed where investment was required through a well-being framework, our first well-being budget, the biggest investment was in mental health. Our plan was to create primary mental health care throughout the country. So if you would walk into your GP's office, your general practitioner's office, and you come in for a particular ailment and your GP can tell that there's a wider set of issues going on, we wanted them to be able to do a warm handover on the spot for someone who may have a range of healthcare training. We acknowledge that we don't have the workforce needed right now for universal provision, but they could be trained in cognitive behavioural therapy or a range of tools to support you or connect you to someone else. And so that network is still being built in New Zealand. It was a 5-year plan. But I absolutely believe that just as we take a preventative approach for primary health care and public health, we need a preventative approach for mental health care as well. And we need to treat mental health and well-being in the same way we do any physical ailment.
Emotional well-being, the leadership of the future and of the present, empathy, how can we use technology in a wisdom way? Thank you very much, Jacinta Ardern, for your words. We take note of, and thank you for sharing your wisdom with us today. Thank you very much.
Thank you.
Thank you. Thank you very much. Bueno, si es que ya os lo he dicho.
I told you it was a privilege today to be able to talk with the former Prime Minister of New Zealand, Jacinta Ardern. It's a pleasure to be able to share her point of view about the advantages of digitalization and all these technological tools that have been developed from a new perspective. And we've talked with Jacinta, we've looked into the future, and we are going to go into the Sanitas Talk section, where experts are going to talk about the most important startups in the industry, and they're going to tell you which are the challenges they have encountered to think about how to change and improve medicine, diagnosis, treatment, with the aim of improving at the same time the quality of life of patients and physicians. Because look, with the AI and phone camera, you can detect skin lesions. With your mobile, you can already detect as well heart arrhythmia. And what would you think if I can tell you that you could even sequence the human genome to create a future health plan? Or how that we can create business models that are related to health. Well, this is no longer the future, this is the present, and we're going to discover it now with the Sanita Talks.
Hello, everyone. My name is Simon Hartley, and I am one of the co-founders of Legit Health. Thank you so much. We define what we do as the next generation in rheumatology. But before telling you what we do, I want to speak about something is a little bit abstract or very out of touch that people many times talk about, which is making the world a better place. Everybody knows about this as a goal, but sometimes it's difficult to see how this is done. And I want to bring today two very concrete examples of how we actually are doing this with people involved in this room, which is great. The way I think about it actually is making the place a better world, because you can think about your local environment, your day-to-day job, and what you can do. And there's just three simple things that we all do. I know you all do, which is you work hard, we all work hard. Then we think of people, and this is important because we're in healthcare, so it's patients that we're helping. And also we collaborate. We don't do what we do alone in a bubble. We work with other people. And you do this. I know you do this because I know you. So you might ask if this is inevitable, that by doing this, it will create change, positive change, then what is the change? It's not so easy to see. And that is what I bring today, some really good example of the change. But before doing that, I want to explain what we do. So we have developed an AI that just by looking at images taken with this, it can diagnose and measure the severity of a really wide range of conditions. Skin cancer, for instance, all sorts of malignant conditions, our latest study is an accuracy of 96%, which is extremely high. But we don't do only this with skin cancer. We do it with around 300 skin conditions. And this is a medical device that is certified, meaning that it has ensured patient safety through a process of regulatory approval. But this is not making the world a better place yet. Let me introduce you to Carmen. Carmen works in Sanitas Seguros, Sanitas Insurance, and she has among her goals one which is to ensure that the patients receive the optimal care, tailored to their needs, but also efficient in a good use of the resource. And the way this is done, well, in basic terms, healthcare is patients seeing doctors. This is ancient. What they did in the previous step is great, which is putting technology in this process. And with this, you increase efficiency. You speed up the process. You increase the comfort for the patient, for the clinician. You avoid unnecessary trips to the clinician. So this is great. But what we have done now is take it one step forward, integrating our technology with AI, also in that digital platform, so you can actually increase the performance of the doctor. So when the information gets to the doctor sees the AI, and together they are better than separate. It also helps train the doctor, because they see cases and cases with what the AI is saying, and thanks to that, it's a continuous learning. It also helps triage patients, and by doing so, it helps achieve the goals of ensuring the optimal and most efficient. And it also provides more information to the patient then and there. So it's more rewarding to ask for a remote consultation because you see immediately some information. This is not all. Let me introduce you to Jorge. Jorge works for Sanitas Hospitales, and he has a slightly different goal: to provide support to doctors, to ensure that doctors have everything they need to help their patients. And what they are doing is they're using the artificial intelligence to create a report that alongside the information coming from the patient, they can see, and that helps them diagnose better. It also helps them perform with more reliability. And this is done through a really easy to perform integration where the doctors can see a really wide range of clinical signs presented in a way that is meaningful and helpful. So what is the change? Well, the change is everywhere. The change is inevitable, and it's happening thanks to your work. And the most amazing thing is that this is not the future. This is happening now, but it's only going to get better in the future as long as we keep working hard, thinking of other people, and collaborating together. Thank you so much.
Buenos días a todos.
Hello, good morning to everybody. What is Ventures by Sanitas? It is most innovation team in order to provide information, especially to take care of our patient. The second objective of Sanitas Venture is not only to position the company Sanitas, but as well as a leader in innovation. Sanitas Ventures not only will react to the changes of the segment, of the sector, but as well we react. We have many different opportunities within the market of insurances, and in Sanitas we want to go a step forward. We are the ones to decide what is the direction of our sector and of our company. Sanitas Venture is one pillar is building, another, well, we will see the three different pillars that we can find in Ventures by Sanitas. And the idea is that through this structure, we can detect the most important challenges and the needs of our company, but not only that, but as well to provide a solution to those challenges with new solutions, with the strategies of our company, of our professionals, and on the demand of our patients and clients. The first pillar is the venture building. Here we are speaking about one of the most disruptive areas, and here the idea is to create from scratch new business. That is, business that responded to the needs detected within Sanitas. We have detected roughly 120 ideas, new concepts that do not exist. And when I speak about these concepts as the different sectors, as for example, Z generation, obesity, maternity, well, I simply want to open a window here so that you follow up us because we are doing important things here. The second pillar is open innovation. Here, the idea is not to start new business from scratch, but to manage that our company, Sanitas, might have all the different mechanisms in order to provide innovative options or solutions, which is not something that we find normally in the corporate world. Most of the innovation solutions will come from startups, but especially from startups that have already a validated product. We are very happy because we have been working with more than 200 startups. Not only we have connected with them, but some of them we have a long-lasting relationship. We have 15 pilot programs. There are 13 integrations of validated solutions in the pipeline of our company. And the third pillar, which is a fascinating pillar, that is talent made in Sanitas. Here we support, we create, and we direct the different teams of internal entrepreneurs within Sanitas. As for example, active in the purchasing department, in the legal department, etc. They join us to incorporate and to create new initiatives to be later on implemented. Here you can see we call it e-doctor, is a pool of doctors that respond to patients without an appointment, or perhaps they have an appointment in 2 or 3 months. So this medical team has a WhatsApp interaction with the patients, and they try to solve their medical problem without even reaching the doctor's office. So the second one is a digital tool that helps in the interpretation of medical reports. In Sanitas Ventures, not only we act within the market, but as well we create the different niches in the market, and every step we take is focused to be mainly focused in our customer, in our patient, in our client. Thank you.
What if you could install an app on everyday devices like smartphones, wearable, that transform these devices into medical tools to detect and monitor your heart health? That is exactly what FibriCheck is doing. Hello everyone, my name is Bieke and I'm one of the co-founders of FibriCheck. For us, it started very personal in 2014, as the father of my co-founder suffered a stroke due to undetected atrial fibrillation, the most common cardiac arrhythmia, a stroke that was perfectly preventable. So since the beginning, we were very motivated to develop FibriCheck, unlocking regulated health on everyday devices, making health accessible to everyone and anyone, avoid these outcomes from happening, and basically reducing cardiovascular costs. Cardiovascular diseases are a big problem today. 25% of the population has a kind of cardiovascular disease. And the challenge is that these diseases are super complex to manage, as often they are multimorbid. But at the same time, in a lot of countries, we see a shortage of healthcare resources. Within the cardiovascular domain, atrial fibrillation, or AF, is seen as a true silent killer, affecting millions across the globe. 1 in 3 is developing AF in their lifetime. And the challenge is that it's hard to detect, as it often comes symptomless, or it can be intermittent in nature, meaning that it can come and go. And unfortunately, still today, undetected and hence untreated AF is responsible for 20% of all strokes, like the father of my co-founder. The majority preventable, as once diagnosed, treatments exist. Of course, diagnosed people also need to be followed up for future clinical decision-making. So it's fairly clear that what we need are scalable detection tools and monitoring tools accessible to anyone, everywhere, anytime. And that's where current technologies often lack, because medical technologies typically today are limited to a spot check in a doctor's office, limited in time, are dependent on expensive hardware. And that's where we set the difference. FibriCheck is software as a medical device. Yes, we have AI at our core, but from a patient perspective, it's super simple. A patient basically is just requested to download an app, and heart health monitoring becomes as simple as putting a finger on the camera each time for 60 seconds. A patient does get immediate feedback, but wherever needed, data is automatically and securely transmitted to healthcare professionals. FibriCheck is today certified as a medical device in Europe, the United States, and other regions, and we are able to detect and distinguish multiple arrhythmias with an accuracy of over 99%. What sets us apart is that we are truly device agnostic. We have been tested on more than 17,000 different smartphones and different wearables as well. And of course, our heart health offering goes beyond arrhythmia monitoring. We also do, for instance, comorbidity mapping, symptom management, and tailored education. And what's interesting is that FibriCheck is available as a standalone application, but can perfectly be integrated into the application of our partners, like we've done with Sanitas. FibriCheck is today successfully implemented across the patient lifecycle. We have been used by more than 600,000 people and thousands of physicians. And we do three main things. We guide unknown patients to the physicians, but we're also avoiding unnecessary healthcare use by offering people that are worried about their heart health a peace of mind when nothing is going wrong. And we have been proven to be very cost-effective in the follow-up of people post-diagnosis. Scaling, of course, was only possible thanks to proven health economics across the chain. We are making an impact today, but of course we cannot do this ourselves. So we are very proud about our collaborations with Sanitas, where we foster innovation together. We transform cardiac care, and where possible, we replace waiting at the doctor's office by preventive care at home. Thank you.
Buenos días. No es muy común empezar.
Hello, good morning. It is not very common to start speaking about a banana in this sort of event, but although we are not very much aware, we share many things with the banana, not only a healthy breakfast or a merienda after school, but that we share 60% of our DNA with monkeys, and with bananas 60% and 90% with monkeys, and the differences between human beings and monkeys is 1 or 2%, very little. It is true that George Clooney would have liked to have these 1 or 2% and swap roles with myself, for example, but this is the manual of instructions with which we are all born, and this manual of instructions, we don't know it. So the 6 million of peers of the different letters that predetermine most of the disease that will be developing throughout our life, and how we will be able to react to many drugs. In most of cases, we are not capable of understanding them and to use them in our favor. And that is precisely what we are trying to solve. My name is Javier Echevarria. I am the CEO of Veritas, and we understand that this manual of instructions, if it helps us, we are going to be able to build something very important, much better, and much more productive as doing it without instruction. Have you ever tried to build a Lego without instructions? I tried tried the mortal star. I bought it in China without instructions, and it was impossible to build. And one day I managed to download these instructions, and these slight differences between one and the other. Very often we walk alongside without knowing them, and how important it is to know this. The sequence about these two people, I imagine that you think that they're exactly identical between these two, but there's a slight difference here. Instead of a G, the second person has an A instead of the G. We are speaking and referring to gene RYR1, and that is a person that under surgery, when receiving any of the different ingredients of anesthesia, would have the huge possibilities of developing malignant hyperthermia. So it would be much easier to go enter the hospital and say that you have that and that you should receive a totally different drug. So that is why we launched the program My Genome by Veritas. Now we are able to explain and to speak openly how we are able to suffer more than 650 diseases, and what are the genetic transferable disease to your children, and how all this information will be very, very helpful for the health professionals. We already know that more than 20% of the cancer patients are genetic, and 30% of cardiovascular diseases are genetic as well. So all of this, and I can say that 20% of all of those that we are seated here, we have a genetic variation that you probably are not aware of. And these variations are very much related to cancer diseases, CVD, cardiovascular disease, and that, as we started with Netflix, with Amazon, with Peloton for sports, but that is what we are trying to do from Veritas. It's a new way of launching this preventive medicine. Now we are more than 800 employees in more than 88 different countries with more than 3 million patients. And I would like to invite you to this new journey, the life-changing journey to live more and in much better conditions. Thank you very much.
Espectacular, totalmente espectacular.
Amazing, amazing science, medicine, prevention, health, our well-being, all of this is changing super fast, and how to assimilate all these new elements, new devices, even to know how are we acquainted to these new devices. We have a new partner. We have Sanitas, that is a new partner, because Sanitas, we are a company which focuses very much in paying attention to the needs, both of patients and doctors and professionals, and they implement all of the different tools, devices, and trying to go a little step before we have invited here Inés Natter, the Director of Strategy of Inés for Latin America and Europe for strategy and transformation. Hello, how are you? I am fully excited with all these topics that you're touching upon and the opportunities that we have to improve the well-being of people, of our patients. The second edition that we are living today is that the revolution, the digital revolution that we are living, but it's a revolution that has to be focused on people. I think that the human quality is really what gives us strength. When we ask our patients, our clients, what are the basic reasons to recommend us, is the treatment by the professional is on the top 3. So that's why we shouldn't forget this direction, and coming back to the digital issues and to give some figures, now we are generating 3 million appointments per year through our app, and we are generating more than 1 million online appointments with doctors. Figures are fine, but what is the answer and reaction of our customers? We are the best app in our sector, so that gives us strength to continue to adapt it to our clients, and that is the reason why you are ranking top, the first ones. When you speak about technology, we immediately speak about artificial intelligence. How do you implement this artificial intelligence? Most of the 30% of the data that we have is all data related to health. So the potential is enormous. So if you see the evolution of startups in Europe, 1/3 is devoted to artificial intelligence, and in the health sector, one goes to diagnosis and the second to the follow-up of customers. So both the follow-up and the diagnosis are the two basic elements that we are working very much, and there we mentioned 3 million appointments. That is when we implement artificial intelligence, when we develop new tools. There we use again artificial intelligence, and we are comparing these once and again in order to use this responsible technology, what we mentioned before. And a part of this, what we want is to make these devices very user-friendly to our customers. And now, can you introduce Blua? Blua was born in 2016. This year we have incorporated new things. We have incorporated digital physiotherapy to do it online and remote session after a check-up, a remote check-up. And we have to continue. We have to continue in the top 10 in the evolution. We are number 1. And we are very happy to announce that we are going to open Blua, the digital hospital. We are incorporating all these new issues, these new devices, and perhaps we can speak about this because we have good collaborators and new guests that are going to take the floor to introduce these new topics. Thank you very much.
Hello, friends. I'm Jesus, and I have the great opportunity of having with being Marta and Cesar to talk about the journey towards the future of health. Yes, Jesus, because this is the path we decided to walk on when we built the ecosystem of digital health, an impassioned trip where we have never lost focus of our main goal, to make our lives longer, healthier, and happier for our clients. Indeed, and to do so, the trip starts where patients are. Because from day one to date, one of the main motivations of Blua was to be close to the health of our patients. Why not? Because from their own homes. Let's analyze Sergio's case. Sergio's reading a book at home, and then suddenly he notices something strange on his chest, and he connects to Blua because, as we said before, we have a tool for digital checkup that allows them to review his cardiological health. Sergio, with his test, has discovered that he could be suffering arrhythmia. It's not a good piece of news, but it's important because he's been able to detect it on time thanks to digital checkup. Blue also gives him the opportunity to talk to a professional. And with the video consultation, our patients can immediately be in touch with the professional they need. And that's what Sergio decides to do. So he speaks to his cardiologist, who looks up his case. Sergio, don't worry, we're going to review everything. We're checking the data of the test that you've carried out. It seems that you're suffering from arrhythmia, but fortunately we've been able to detect it on time. So I'm going to send you a home ultrasound to see how your heart's working. And that's how the digital hospital Blua works, with digital technology that allows patients to be in contact in connection with their health from the safety of their homes. With Blua, we've been able to do away with the walls of hospitals, and it's a reality that hospitals go to the patient's home and not the other way round. For us, a few years ago, this was just a dream. But today, this way of monitoring, caring for, and treating our patients is our daily activity. Yes, Jesus. Just like with this ultrasound that a radio diagnosis technician is doing in Sergio's sitting room, that will be remotely interpreted by a physician with the help of AI. And all of this without Sergio leaving his home, and with an ultrasound result, his cardiologist tells him that he's going to undergo a catheter treatment, a small surgery that can be done at the digital hospital Blua, where we offer all the developments of medicine and digital health, and we put them at the service of clients like Sergio to solve his health problems in a swift and comfortable way. And if, just like him, he needs small minor surgery, it can be done with maximum guarantees in the most developed and intelligent facilities with robotic OTs that are connected, and they allow to share information and knowledge. In Sergio's case, the surgery has gone perfectly well, done by Dr. Fuentes, who's done it in one of these smart OTs, but with Dr. Carrasco's supervision, who has connected from the hospital in Barcelona. So after one night under observation, monitored in one of our connected rooms, the cardiology happily states that the arrhythmia is better and tells him he can go home. And now with our ecosystem Blua, we're going to continue treating Sergio wherever he may be. And it monitors your health, and with a stereo of wearables that are adapted to each patient, we can have a ongoing follow-up of Sergio's heart, just like with happens with other diseases, because Blua is also about prevention. And with all these data that we have compiled from the monitoring and follow-up of our patients, we are able to offer them the best indications adapted to their lifestyle. In brief, we're giving data which are going to be for their welfare, with health plans that are designed to the medical needs and requirements of each patient, with training plans that allow them to live a better life and remove risks, bearing in mind their medical condition. with the ongoing support of a multidisciplinary team that is taking into account every factor that may have an impact on their health, and of course, why not, with direct connection and medical supervision all the time of our best professionals. They are all the services that we've seen today, and many more, from the simplest to the most sophisticated, that define our digital healthcare system. This is Blua, Sanitas' trip towards the health of the future. Great digital abilities interconnected with the best face-to-face healthcare hybrid system that we are improving today. In our present, the healthcare of our patients, and design with them their health for the future.
Espectacular, como hemos visto.
Spectacular, as we've been seeing this trip via Blua. Indeed. I think we all feel comfortable in here because we are in the best hands, so thank you very much. You know, it's a spectacular trip that's taken us up to this digital hospital, Blua, where we once again insist on this combination symbiosis, essential one between the digital and physical side of things. What advantages does this have in it? I think it's been very well explained. It has advantages both for the patient, in the sense that you can diagnose sooner, less waiting time, less trips, as well as easier follow-up of healthcare issues, and of course, for the professional, it's also an advantage here. The professional can treat sooner, remotely, as we've been able to see, and have at all times the maximum amount of information available. So I think that in brief, I'm talking about the coordination of many different elements that ensure that we are in a very good position for the future of health. Yes, advantages for physicians, but also for patients. And let's play a game. Let us imagine that we go on a time machine in a near future, where we have in our hands the solution to not become sick. Let's go even beyond. We can know which diseases we may be able to suffer in the future, to create now an attack plan. That would be wonderful. Yes, I think we've talked about this before, haven't we? I understand that you're talking about genomics, aren't you? Yes, of course. I can anticipate that we are working intensively, and we believe, yes, that indeed we can design healthcare plans that are customized, prevent diseases, and at the same time might even be able to recommend the best medications possible for each patient. A very interesting field of study. We're developing it, and I'm sure that we'll be able to tell you more about it in the future. I think we can look at it in a video. The future of health is written in each and every one of us. Welcome to the genomics area, a scientific revolution without precedents, particularly in the field of medicine. In very little time, we're going to be able to prevent, delay, or palliate the effects of a great number of genetic diseases in our patients before they suffer them. Genomics is the maximum expression of medicine in the future: preventive, personalized, precise, predictive, and participative. Genomics revolutionize the diagnosis and treatment of diseases because it allows us to adapt therapies to the needs of each patient, but also prevention and prediction because we can make informed decisions about our lifestyle and preventive medical care. Sequencing and analysis of the genome is a paradigm change, and in Sanitas we are preparing to offer in the near future this new predictive and personalized medicine to our patients. A new way of treating the health of people, which promises to continue transforming our world in the next few decades. Well, thank you very much, Mark. Thank you for talking about this new way of transforming the healthcare of people. From the beginning, we thought that this session should be a dialogue based on two strands. Present, future is one of the strands. Everything that we've seen here seems to be something about the future, but it's not. It's not only that, it's also part and parcel of our present. The second strand that we thought about is what has to do with the digital and face-to-face, which sometimes has been presented as clashing against each other, but not. It is clear, crystal clear, that they're complementary. We are reaching the end of the event, and to conclude with the second edition of Future Health, the event, I would like to see the view of the health of future and past by Iñaki Peralta, who is CEO of Sanitas and Bupa for Europe and Latin America. A round of applause, please. Iñaki. It's a pleasure to see you here. Congratulations for your progress. We said at the beginning that we've learned a lot today, and there's no doubt there's a lot of hard work behind it, but a lot of reflection of where you want to go towards to. Yes, there is a lot of reflection. But please, first of all, let me greet all of you who have come here today, this morning. An important day for Sanitas. And I would also like to thank everybody that's connected via streaming. Yes. It's true what you've said. The first thing I believe we have to go back to is the past decades of Sanitas. I think there's been something that always in the history of Sanitas has existed. You know, our four ancestors and Sanitas did something really well, which is to look for the best alternatives available for healthcare provision to provide the best medical care possible. And this is also very closely linked to the Bupa proposal that we have. Our proposition in Bupa is very clear as well as very ambitious in its scope. You say it very quickly, but you build very slowly to become the healthcare company that is most focused on the client, on the planet. It's easy to say this, but to be the most focused on health means that a lot of effort has to be made. It means that you have to be hardworking and insistent. We also have a healthcare and medical clinical network that is our own, and not our own, not only proprietary. We also do it with partner centers, but having our own professionals and healthcare staff to research and to learn more and to implement as fast as possible is also, our ideas is also good. We've seen this interest, this hard work, this energy, yes, the wanting to know more. Yes, it's here, your perseverance. And yes, Iñaki, even though I'm a journalist, we always like to think about headlines. So I think that the headline is in my mind. The headline is that the Hospital of the Future is already here today. It's called Blua, and it is Sanitas Digital Hospital. So with this headline, I'd leave you all with Iñaki Peralta. I think that Marta's headline is really good, but I think there's a little bit more to it, you know. I believe that the medicine of the future is already here, present in Sanitas. The efforts that we've seen described this morning are focused on having a healthcare that is far more precise, personalized, predictive, preventive, and participative. It's a medicine that's merely better, and we are reaching it thanks to our dreams. Those of you who follow us closely have heard us talk constantly about that. We're dreaming, dreaming, and dreaming. And dreams mean something very simple. Things that seem part of the future should be here today. And that's precisely what we're doing at Sanitas. And that's precisely what we're doing at Bupa, to continue being the healthcare company that is most focused on the patient in the world. Of course, this may sound like you're dreaming a lot and you're not doing very much, but the truth of the matter is not. That is not the case, because in the next 12 months, there are dreams that are going to come true. And this is precisely what we came to talk about here today. In a year's time, we'll be celebrating the third future event of health. And We will tell you that we were dreaming about a medicine that was more precise and preventive, and you will have been able to see the impact that it has had on people during the past 12 months. We were dreaming about having a digital hospital, and you have seen the opening of the bluer Sanitas Valdebebas Hospital. We were dreaming of a bluer ecosystem, including many different abilities. But you'll see in 12 months' time that is going to have even more capabilities. We were dreaming of having the healthcare leaders of the future, and you will be able to see that jointly with the European University, we've opened the first degrees to train professionals of the future. And we were dreaming that Sanitas played a relevant role in research, and you will see how we have been able to mark landmarks and how Sanitas, in cooperation with the pharmaceutical industry and other hospitals, is reaching landmarks that are saving lives. In brief, you will see many, many things that were dreams in the past that will come to life in the future. But above all, you're going to see something that is very exciting for us, and that we're very clear about it in Bupa, that there will be more people trusting us, so that we will be able to give them a longer, happier and healthier life. That is precisely what is pushing us forward, and that is what we're going to see in the next 12 months. There will be more people trusting us. However, for this to happen, we need you all. We count upon each and every one of you, with all of you, because the challenge is huge and we need to do things really well. We've got to do things because we have a lot to lose here, because we are talking about the hope of people, and sometimes we're going to be their only hope and their last hope. And you will always find Sanitas there trying to bring the future into the present to be able to continue giving help. And we'll never get tired of looking for solutions in this wonderful and impassioned challenge that we have ahead of us. We are looking towards the health of future, bringing the best digital arms to do so, but you must be absolutely clear about this. We're going to try to give the most personal and close approach to patients. A beautiful and brilliant way of viewing health, full of light. Thank you very much.